program You're in Your Health and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Asthma is a significant health concern that is affecting a good number of Cameroonians. In today's edition of the program, we explore what asthma really is, its symptoms, causes, and how we can possibly manage this condition. And we'll be receiving a public health expert who will be answering all this question for us on today's edition of the program. But before inviting over our guest for the day, let me welcome my guest, my co-host, Issa Lucy Legu. Hello, Lucy.
Hello, Immaculate. Hello to all our listeners and viewers out there.
As I said, our guest for the day is a public health expert. He's known as Dr. Ferjo Etienne. It's a pleasure to have you on the program today.
Thank you for inviting me today and for this wonderful topic on the asthma.
Just go straight away to our question, which is what really is asthma and who are those affected by this condition?
Okay, thank you very much. Generally, for people to understand well, asthma is a chronic inflammatory infection disease, actually, which cause what? Swelling of the airways of the respiratory tracts. Then we cause what? Because you have the swollen, reduced airway, lead to what? Difficulty in breathing in general. Chronic condition leading to inflammation of the airways. Swelling, when you have swelling, then what you have, next thing, you have reduced airway intake, then causing difficulty in breathing. In general, I want people to get what is asthma.
Now, what can cause the swollen airway? What can trigger such a condition?
When you talk about asthma, let's talk most of the time of risk factor. Okay, we talk about asthma because asthma has two parts. Most time you like to say unique factor or familiar factor, risk factor, and environmental factor. When I talk familiar or genetic factor, is that in your family you have your mother, you have a sister, you have an uncle had asthma. You have unfortunately high chances to get asthma. That's what about genetic factor. The environmental factor, it can be due to if you're in an environment when you have air pollution. Air pollution. If you're in an environment you have too much dust, because there's certain element will trigger
asthma.
Those reactions and lead to what called asthma. Let's talk about asthma. So it's what actually when you say you have asthma, it means that you have an inflammation of your airways. And when then you have a trigger will come in, make this thing to be worse, be swollen, that you have a reduced airway, and then you have that difficulty in breathing, and you have all the symptoms of asthma that you have.
Looking at air condition, what's the relationship between air pollution and asthma? Can you detail that for us today?
Yes, you need to take in consideration air pollution, so it was really difficult. And today we are sure of saying that air pollution today, being outdoor or indoor, will provoke certain particle matter, will directly affect the respiratory system, the respiratory airway. And then, as I said, if you have asthma before already, or maybe you have a minimum kind of signs of asthma, because of those small particles produced by air pollution, we touch those lining part of the airways and increase the swelling. And when you have a swelling, I want you to look at it as if you have a pipe at home. I imagine you have a pipe at home and you have too much waste. The more you have waste inside the pipe, then if you have the water has to throw there, water will come there. You have a difficulty of the water to flow through the pipe.
Yes.
So it's the same thing with asthma. You have airways, you have inflammation, and because you have a swelling of the airways, the air that you are bringing in has difficulty to pass, and then you have all the signs of symptoms of asthma, difficulty in breathing. At times you hear about wheezing. Somebody is there, you see noisy breathing and all the stuff. That's why you talk about air pollution now is a really big major risk factor of
asthma. And doctor, before we go to the symptoms, we'll give out the numbers for those who like to join us on today's edition. We have 670-547049, 670-547049, or you can reach us via 656-62-2222, 656-62-2222 at the end. And back to you, doctor. We would like to get the symptoms of this condition.
Okay. Before talking about the symptoms, I want to say that asthma today, unfortunately, is the most common chronic disease for children. Though even adults can have asthma. As I said, when you have the swelling of your airways, you have the difficulty of air to go inside. So for sure, you have shortness of breath. But you have difficulty in breathing. You may have noisy breathing, like what you call in medicine wheezing. At times when somebody have asthma, you see somebody beside him hear the noise. You have that sound that somebody have difficulty in breathing beside you. After that, you have tightness of breath. Your chest is tight because you have discomfort for you to breathe because you have like restricted. This is three major signs of signs of asthma. I mean, if your asthma got worse, it can even go to death. So it's a really critical condition. You have to take care very well.
And how can this be managed?
The most important part about asthma, you have to know what is your trigger, because each asthmatic patient has its own trigger. Is it because you have maybe pollen from those flowers? Is it because in the environment you have too much air pollution? Is it because beside somebody who is smoking? Okay, you have to avoid to be where you have your triggers. Okay, is it dust which is disturbing you? Because people have dust at times. Dust can trigger asthma. It dust will disturb me. You have to know what are my trigger, and first thing you have to avoid to be close to your trigger. That's the first thing. The second thing, you have to know that if your doctor already prescribed you a management plan, you should really have always beside you your treatment to avoid those crises. Okay, at times you hear people with asthma can have worse episode when they are close, for example, an environment where it's too much cold for some people or too much heat. So other people who have doing exercise, like strenuous exercise, become to have asthma. So the most important thing, you should have your asthma action plan, okay, that you have discussed with the doctor, and based on the asthma action plan, you first of all do what? Run away from your trigger. The second thing, you take your medication as prescribed by your doctor. And the third thing is to promote to stay in an environment which is safe from air pollution.
How is this condition diagnosed?
As all the disease, first of all, you come by the history taking. So the doctor will first of all go back to your history, what the different symptoms you have. You do a clinical examination of when you are doing your crisis, and the last part, you do not lung function test. Okay, lung function test can be spirometry, can be peak flow, but those tests will help to know what are the capacity of your lung. Based on the capacity of your lung, you diagnose you with asthma. Okay, and when you're already diagnosed with asthma, put something in mind. You cannot be treated. You can just manage the different signs and complications. Okay, because asthma is a chronic condition that cannot be treated, but it can be managed so that you can live normally. That's the thing.
So there's no treatment?
There's no treatment, actually. You manage the symptom and you prevent you to have a crisis of asthma. Okay?
Then what role do the inhalers, the medications play?
As I say, you say with inhaler, because thank you for coming back to the management plan. When you have asthma, okay, it's already diagnosed, because I said earlier, it's an inflammation process happening inside your airways. You propose to you what? Some drugs will help you to reduce the inflammation. Okay, it can be shock acting. That most of the time, all of us know that salbutamol or Ventolin, because Ventolin is Ventolin, or it can be long acting. Okay, that's other type of treatment. And when it's really severe, the management is always different, because it can be on oxygen, it can be injectable medication, corticosteroids, for you to avoid to have really complication based on asthma, because nobody can live without having coming to the lung, actually.
And now, what are the most effective treatments? Is it the inhaler, like you mentioned, or the injections, or maybe the oxygen? What is the most effective?
The management plan depend on the state. It's a mild condition, just your inhaler, short-acting inhaler like salbutamol can work. Okay, if it's moderate or severe, you can go to really long-acting, or you can go to injectable corticosteroid to stop. Because the process during the management plan is to make sure that that inflammation and or that swelling will not get worse until you close complete your airways. So you have to give me treatment will help you to do what? To reduce as fast as possible the swelling or the inflammation will prevent you to have air coming inside your lung. Okay, so short acting act because short acting you act fast, have the rapid effect. But if the short acting is not working, you move on to other plan to make sure that at the end of the day you are safe from complication due to asthma.
And now, Ima would also like to understand from the doctor, because I'm sure many people are watching out there. They are like, what is the role of an inhaler? What is the role of medications? What role do lifestyle changes equally play when we are trying to manage asthma? What role mostly do lifestyle changes play?
Yes. I was talking about lifestyle. When I talk about lifestyles, I was insisting on you know your trigger. Because if you know your trigger,
you know how to better manage it, for sure. Yeah.
That's why you talk about lifestyle. Thank you. And now, so when you master your trigger, really, you avoid your different trigger. So you stay in environment we safe from air pollution. Hopefully, I hope that you have much environment like that. You stay in you avoid a room where you know that if you know that does disturb you. You understand that if somebody is cleaning the hospital, you have to avoid to stay in that kind of area. Okay, you really have to master what causes you to have it.
Okay.
But you have to understand also that most of the time when people have when you have those viral infection, okay, because viral infection where so okay, you have catarrh can make you to worsen to go to that type of, so you have to run away.
We have a call on the line.
Okay.
Hello.
Yes, good afternoon, madam. Good afternoon, doctor and crew. My name is Richard. I am an asthma patient. I just want doc concerning lifestyle of an asthma patient to say something about kind of sporting activities, the minimal sporting activities that an asthma patient can involve himself in. Thank you. Thank you so much. My name is Richard.
Okay. Thank you so much for participating. Sport, and I think it's one of our questions, right?
Yeah, it is one of our questions.
Yeah, sport and asthma. Let's see. At time, I know it's tricky. Is kind of depend. Most of the time, strenuous sport activity can make you worse. Yeah, asthma. Okay, can make you have an asthma crisis. Okay, but I cannot say asthma patient don't do sport.
Yeah,
sport is good for
the health.
So now you really have to discuss actually with your doctor. What is the best kind of sport that you should do? Swimming can be good for you. Sport with less strenuous activities can be good for you. But make sure always that when you do your sport, you always have your inhaler beside you to prevent in case of attack what to manage, because actually it's a management plan. When you discuss with your pneumologist of your doctor, we discuss with you what are kind of activities you can really do only to avoid to have a crisis due to that. But I cannot say to people that sport is not good. I'm sorry, sport is good for all, but you cannot do sport like extreme physical activity like other people because you have asthma, because it can make you to have higher chances to go to asthma crisis.
Now, doctor, you talked about knowing your triggers. In an environment where, let's say in the village, in the suburbs where people rely on firewood to cook their food, how do you expect an asthmatic patient to avoid such, whereas they need to cook food, they need to eat?
Okay.
Imagine their trigger is from the smoke coming out from that firewood.
Of course, you see that the trigger is the smoke.
Yes.
Thank God today, during the COVID-19, we have developed this habit of to wear mask. Okay. Thank you.
Mask.
I mean face mask. So you have dedicated mask actually to reduce air pollution that you can use if you are obliged to use smoke. Okay. But you make sure that you don't do something that make you to go to spend more money, because actually, as I say, it's a chronic condition. If you have asthma crisis, you have to spend money. At times you can even not go to work. If you don't go to work, it can have an impact in your financial income. So you have to really understand what is your trigger. Make sure that you make an equilibrium between your trigger and your life. If maybe if you are cooking, you have asthma, you're obliged to cook to make money. Look for a ways for you to be you have a stable condition. To avoid you to spend money, you cannot make money based on cooking and go and spend all the money in the hospital.
Exactly.
It doesn't make any sense.
Lucy, you got the fact that some people were complaining of the fact that Vantolin is quite scarce in our pharmacies, right?
Today, yeah.
What are some of the risks if an asthma patient does not have his or her Vantolin with him or her?
Of course,
in case they have a crisis.
If you have a crisis, always start with Ventolin. If you don't have Ventolin, you have to go to the hospital, because in the hospital we have other medication can give you to help you to prevent.
So please, what are the first aids? Like if you have an asthmatic patient in front of you really dying, before the person wants to be rushed to the hospital,
what should you do?
What can be done as first aid?
Okay, most of the time, when you have asthma, the person need to take air. Most of the time I see when somebody have asthma, people want to count the place. People need air. That's the first thing. Okay, the person need air, and you have to check. If the person need air, you leave the person having air for some short time, okay? If you discover that after the 5 minutes with air, the person don't have Ventolin beside him, you cannot do anything for him, the symptoms persists, you have to rush him to the hospital, okay? By that time, it can be just a mild condition. You leave the patient in what you call, in French, you say position d'atteinte sécurité. You always have a position where you place a patient to make sure that the patient is at least is safe from different environment. You put the patient in that position, and to make sure that at least you look at the patient. Does he have worsening signs? Even though I try to do what I have to do, like allow the patient to have taking air, need air, a safe place.
How do you place that person?
Left side.
Lie down.
That's left side. Say left side. Okay, you really in the left side.
Okay.
Now when you left side, the special way to put in the left side. Okay, there's more practical. Your left side. When you put on the left side, the patient you look at the patient. You don't allow the patient be on left and just go. You allow the patient is on left side. Okay, you look at the patient. Does he breathe well? Normally, if the patient does not breathe, it means it's an emergency.
Okay.
We make sure the patient is breathing.
What about mouth to mouth? In the asthmatic patient, do you also practice that?
No, mouth to mouth is when you have what you call a heart arrest.
Cardiac attack.
Yeah. Because you know that we talk about air. We also know that you can also put in some air through the mouth.
Yes, I
of the
understand.
patient.
But the person don't, for sure. Our environment have more air than the more that you are giving it to somebody. Okay, but during heart attack, cardiac arrest. Offshore is obliged to you do mouth to mouth, you do cardiac resuscitation with you pump the heart, all the kind of stuff. But you understand that yes, a way to know if you have cardiac arrest, you look at the lung. If you don't breathe and the patient is unconscious, is a sign that somebody needs to have a cardiac massage as an emergency, fast as possible. You don't move the patient stay on the site. You do your cardiac massage on spot, and you hope the hospital come to you. Don't rush the patient to the hospital. No. Patient stay here, the other patients come to the place.
Thank you so much for accepting our invitation to this program.
Yeah, it was a pleasure. It is really good for us to put in your mind that asthma is a chronic condition. You don't get treated due to asthma, and asthma happen because you have at the level of your airways is swelling because the trigger came there and increased the inflammation process and leading to difficulty in breathing because air is not coming in easily. And what you have to manage is to give them some treatment like those short acting agonists will help to reduce inflammation like salbutamol and help the patient to breathe normally. Okay, it's a condition that can be well managed and you make you to live normally. Having asthma doesn't make you to stop doing what you have to do.
Okay. Thank you, Lucito, for being part of the
Always a
program today.
pleasure.
I equally want to thank our technical crew, Jonathan Babula and Bertrand Bonzini. For presentation, I am Immaculate Fogwe, and we had as guest Dr. Ferjo Etienne. He is a public health expert. From us to you over there, thank you so much for watching and listening. Have a wonderful day. Bye-bye for now.